Another one is obviously just moving your body. I would say specifically for longevity, strength training is something that people aren't really doing enough of.
Very good point.
Yeah, and I mean for, I always say like muscle, I probably stole this quote from somebody, but muscle mass is the currency of aging. And so we have a harder time putting on muscle mass the older that we get, especially as our hormones decline.
Yeah.
So it's so important for our bone density, for our mobility, our coordination, our balance to maintain muscle mass.
For like insulin resistance.
For insulin resistance, 100%. Yeah.
Absolutely.
Yeah. So I think that it's sometimes harder to get women on board than men.
We're all a bunch of cardio bunnies.
Yeah. What I tell a lot of women is that, you know, you're not going to get super bulky, you know, and like, don't be scared.
That's a very good point.
Yeah. Like,
everyone's worried about being that like, well, not everyone, but yeah.
a lot of women. Yeah. And so, I mean, strength training is, and you know, just lifting heavy is one of the best things that you can do for your body as you age. And as you said, as like, even from, an insulin resistance perspective, you know, the more muscle you have, you know, that's basically like a vacuum for the glucose. So
yeah, and I find like it's also depending on where your nervous system's at, it's one of the easier things to do as far as like the negative consequences of exercise.
100%.
Because like you also, especially in like that demographic of people, you'll get the other end of the spectrum where people are over exercising and burning themselves out. And like, what are some conversations you have with like that person? Not like, oh, I'm a couch potato and now I want to exercise, but almost like the other side where it's like, have you looked at how you're exercising and maybe that's not emphasizing the right areas or like,
That's a good point. I think that, and again, I think it's especially women that or just what I've seen, where a lot of them, you know, are coming to me sort of still in that same age range, like let's say 40s, 50s-ish, and they are exercising like every single day, but they're hitting spin class. They're, you know, training for their next marathon. They're
marathoners.
They're doing like hours of cardio and really zero strength training. And what that's actually doing is it's just jacking up your cortisol. And so there's a reason that, you know, they have some weight loss resistance and they're so fatigued and they're like in fight or flight all the time. And they're chronically stressed and they're not sleeping very well. And, you know, it's all, they're basically just running on fumes.
Oh, totally.
At the end of the day.
I feel like if you're going to train for something like extreme, like a marathon, I think you need to really take care of the other areas of your life. Yeah. Otherwise, that's going to burn you out. Yeah. Because that elevated heart rate type of activity, like I can't do too much of it anymore. No. Like I used to be really into like spin classes and like going for long runs. Yeah. I ran a half marathon. Like I thought it had like the more intense, the better. And I used to think like it was almost a waste of my time if I wasn't like drenched in sweat, exhausted by the end of my workout. But what I realized after Boucher is because I was so effing stressed everywhere else in my life. I was working too many jobs, studying way too hard. Like I was vulnerable because of all the stress in my life. And so trying to do high intensity cardio on top of that just messed me up. But then my body responded so much better when I actually took my foot off the pedal, focused on like lower intensity strength training and like, you know, Pilates or something like that, and like ditched the spin class. And I actually like physically look better than I ever have because I don't feel the need to like physically stress my body all the time because I just have too many other stressors. 100%. I think that like I was the exact same way. I think that even especially I would say in my for most of my 20s, I would try to force myself to like go for long runs and do, you know, if I was ever doing weights, they were like 5-pound weights, right? With like a million reps sort of. Yeah. So I think I was just like, I was so focused on the cardio and kind of, as you said, it felt like it was a waste of time if you weren't feeling like you're going to throw up at the end of it, essentially. And now it's like, I still do
I box, but I don't box as much as I used to because again, it was a little bit too hard on my cortisol, I would say. Yeah. And so now I focus more prioritizing strength training, lifting heavy weights, still doing boxing because it's great for stress relief for me if I'm doing it at, once or twice a week. Yeah. But when I was doing it, let's say 4 times a week, I noticed my sleep got worse again and I was a lot more stressed and it was working against me, kind of as you said.
Yeah, which is a tough thing to tell people because you have the right intentions. It's kind of like diet sometimes too. You're like, I get it. Like you have all the best intentions and like, good for you. You have so much like motivation. Like, yeah, that's amazing that you're like forcing yourself to go for these like 20-kilometer bike rides and like doing all of these like high intense things or going on that extreme diet that's like very hard to stick to. Like it shows you have amazing willpower and you have like the desire to create big change in your life, but you're just focusing it in the wrong place. Like you're trying to like starve it out of you or run it away. Like all your problems can't really be solved that way. And sometimes the more extreme is not the better.
And I think that kind of as you were just like alluding to, I think that, it's the over exercise for a lot of people. And then, under eating too. Like, I think that a lot of, especially when you're pushing your body that much on from an exercise standpoint, a lot of, I would say, again, women in particular are on these super calorie restricted diets and also, I would say, like not focusing enough on protein. And that's a big thing. I think that I'm not a huge fan of super strict diets or like calorie counting or anything that doesn't feel sustainable. Yeah. But I tell my patients, I'm like, okay, I'm not saying that we're gonna get too in the weeds with like counting your macros or anything like that. Yeah. Because again, like not super sustainable, but I just say, for 2 days, I just want you to track how much protein you're getting in. And just track like an average day, a couple days in a row. And most people aren't getting in half of what they should be. No. And again, as we age, we have a harder time putting on muscle mass. So strength training and protein are huge. And I find that when people actually eat more protein, it's like they see those body composition changes that they've been working so hard for by like eating all these diet foods and whatever.
I mean, I noticed a massive change in your body when you started focusing on protein. Like I remember being like, what are you doing? And you're like, I'm eating more protein. Yeah. That's it. That's all I'm doing.
And I find that, when you eat more protein, it has so many beneficial effects, obviously, on your insulin resistance, your insulin sensitivity, and also just making you feel full after a meal. You don't feel like constantly snacking on things when you're full from protein. So, I mean, I'm not a huge fan of, again, giving anything too restrictive to patients when it comes to diet, but just, again, kind of focusing on the basics, like, adequate protein, good micronutrients in your fruits and vegetables, fiber, complex carbohydrates over simple, healthy fats, and, it makes it a little bit more digestible for people rather than them feeling so restricted. Yeah.
It's a good point. All right. So there's so much more that we could talk about when it comes to foundations of health. I mean, we're definitely scratching the surface and I'll have to bring you on to like dive into more of the like details of these things. But I did want to make sure that we had enough time to talk about something that I know this type of demographic really is interested in from a longevity standpoint, and that's hormones. So, as males go through andropause, the decline of their testosterone and things like that, or as women go through menopause, or just hormone optimization in general, outside of like just talking to them about their symptoms, what are some things that you do to like actually get a good gauge on, do they have low testosterone? Do you have estrogen problems?
Yeah, totally. And that's a good point. I think that men and women come in and they think what they have is symptoms of low testosterone, low estrogen, whatever. And, maybe they're at the age where that is more prevalent. But yeah, when it comes to testing hormones, I would say there's different ways to do it, right? And it can change based on the patient as well, what I decide to do, but generally blood, urine, and saliva are the different ways we can test. I would say saliva is definitely the most accurate of a picture for what's happening in the actual tissues.
Okay.
Urine is more just looking at metabolites of those hormones and how it's actually being metabolized by the body.
Okay, so what you're referring to is kind of like, for example, like how our liver metabolizes progesterone, estrogen, things like that.
Yeah, so again, urine's mostly testing the metabolites, and then we can also test in blood.
Yeah.
And, I always talk to my patients about how, going on, let's say, testosterone isn't going to solve all your problems. Going on, let's say, estrogen and progesterone for females isn't necessarily going to solve all your problems if we're not actually looking at the whole picture.
Totally. So like even if you have like a blood test saying, low bioavailable testosterone, or, a dried urine test saying, like something's up with your estrogen, progesterone, something like that, like it doesn't necessarily mean like immediately let's go on hormone replacement therapy.
Yeah. And I think also recognizing that there's other hormones at play besides your sex hormones, right? So insulin being a huge one, right? Yeah, and I know that, we love to test not just your fasting blood glucose and your hemoglobin A1C, but also your fasting insulin.
I wish more people would do it.
Yeah, so and I think it's becoming a little bit more common in the conventional system, but I don't think I've ever really seen a patient come in with their past blood work having run a fasting insulin ever before.
No,
and
rarely.
It's really one of the first things that's going to go up when you start to go through the stages of insulin resistance, and we can catch it early before it turns into diabetes or even, it's a big spectrum, right?
Yeah,
so
for sure.
So insulin being a big hormone that I always test on patients.
Yeah. And like what you're kind of getting at is like, it'll affect your testosterone.
Exactly. Yeah. It'll affect your testosterone. It'll affect your estrogen. And then also, your thyroid hormones. And, I'm sure we both like to get more of a comprehensive picture of thyroid hormones than patients usually have run.
And I think this is like just a good thing to just like briefly talk about. I mean, it's a bit of a rabbit hole, and I don't mean to like bring us off the topic too far, but like, can you just briefly explain like what a comprehensive thyroid panel looks like? Because I have so many people who come in and they're like, my thyroid's fine. I had it tested. And I mean, you and I both know what they're usually getting versus what they actually need to for sure say they do or do not have a thyroid issue. Yeah, so conventionally, when patients go to their MD and get their thyroid tested, they'll test TSH, which is thyroid stimulating hormone. That's basically just the signal from your brain to your thyroid that, make more thyroid hormone. But we have zero picture of what's happening after that unless we test the active thyroid hormone. So we have T4, T3, and T3 is the most active thyroid hormone, the most bioavailable. And then we also want to see, and not for all patients, but definitely for a lot of my patients, I test their thyroid antibodies because autoimmunity against the thyroid gland is very common. And so common. I've caught a lot of different cases where TSH was totally normal, but they had super elevated, let's say TPO, so thyroid peroxidase antibodies. So, it's important to get a complete picture because if we're missing things, we don't really know what we're targeting, right? Yeah, you could have a thyroid issue, but you only ran the one thing, and so we've been ignoring that. Yeah. And we're wondering why you're not getting anywhere. Yeah. Something like that.
100%.
Yeah, and it is a really good point talking about like the interplay of all of these different hormones, insulin, thyroid, cortisol. Yeah. And yeah, it's different testing methods for all of them. Yeah. These are the things you need a doctor for.
Yeah, and it's not like we do this, it's not like I would run like blood, urine, and saliva hormones on one person, right? Yeah. You kind of go on a case-by-case basis. And, you're also tracking over time as let's say you give a patient bioidentical hormone replacement therapy, you're tracking over time whether it is in, let's say blood or saliva, what their hormones are looking like to make sure that you're in a good safety profile. So, but definitely it's super important to see what different systems of the body are doing, what your different hormones are doing, because everything does interplay together. And then, let's say, you're giving a patient estrogen or something, and we were kind of talking about this earlier, but it's like, what if your patient is only having a bowel movement once a week and you're giving them hormones, but they don't actually have a way to detoxify? You're not actually
excess hormones.
Yeah, they're excess hormones. They're not. You're not actually starting them at the right place. you know?
Well, exactly. If we were to like stereotype,
yeah.
Like when you say like you have like a male coming in who's like, I think I have low testosterone, outside of giving them or recommending they go on testosterone replacement therapy, like what are some things that you're talking to them about before that? Like what are some of those like things you see them ignoring that could help their testosterone that don't involve going on a medication?
Yeah, and it's so funny. Yeah, it's so common that the only thing on their chief complaint of their intake form is, I think I have low testosterone, and they'll be like, oh, I want to test it, or like, I want to see if I'm a good candidate for it, whatever. So anyways, it's just really funny because you'll go through a whole intake and asking them all these different questions around their symptoms, their lifestyle, etc. And I would say that, so many men are doing things on a daily basis that are contributing to low testosterone. So of course, we're likely going to do some comprehensive testing and everything, but it's also just kind of asking those questions. A big one is, how many drinks are you having per week? And it's always like, oh, like occasional. I'm like, what does that mean? What does that mean? And like, oh, just like, a few drinks a week. And they won't give me a number. They're like, it changes every week. I don't know. And I'm like, okay, well, like, let's say, I was like, when you come back, like in a couple weeks or whatever, I just want you to keep track for 1 week. How much alcohol, like count the drinks, add it up in your phone. And let's just out of curiosity's sake, there's zero judgment because I've heard every number. But just for your knowledge and for my knowledge, I'd love to see what your average week is looking like. And it's hilarious. Like they come back and they're just like, wow, like I was having 5 or 6 drinks a night, almost every night. And I just, in my head, it was only, a couple times a week, but it's
everyone's version of a few is different.
They add it up.
You grew up north. A few might actually be a lot.
Saskatchewan,
a few.
But it's like, oh, I had 50 drinks this week, and that was honestly a pretty average week for me. And so
alcohol is a big one.
Alcohol is a huge one, and it's one of the things that are it's going to directly lower your testosterone, right?
Yes.
So I think that's a huge thing to be aware of. Is like, okay, you're so keen on maybe going on, seeing if you're a good candidate to go on hormones, but you're doing this thing to your body on a daily basis. And I'm not saying to stop drinking, but be aware of what you're doing. We all know it's bad for our health. We all know this. And so it's kind of just deciding how important it is for you to cut back a little bit. For some of my patients, I've said, okay, is this doable? During the week, Monday to Friday, you don't drink. And you have like a little mocktail at night if you need a little something. And then on the weekends, you allow yourself to drink. Hopefully not binge drink, but like you allow yourself to drink on the weekends. Like, is that doable as a first step? And a lot of my patients have found that that's something that they can kind of wrap their heads around. And then they realize during the week, like, wow, I actually didn't realize how tired I was before every single day. Or like, maybe they started wearing an Oura ring, like, oh, my sleep scores are so much better. And they
which
actually
also affects testosterone.
And then so then coming to the next thing, they talk about, let's say in their intake, they talk about their sleep. And I would say a big thing which we've already talked about is just not giving themselves enough hours in the night to get good restorative sleep. And again, that's one of those things that's going to lower your testosterone, lower your growth hormone, contribute to insulin resistance. So, talking about those lifestyle things that people are doing on a daily basis that's either helping them or hurting them. Those are a couple things. Definitely, not prioritizing strength training, not prioritizing proper nutrition, or a couple others. But I would say, those are probably the big needle movers from a lifestyle perspective.
Yeah, exactly, right. Good places for people to start. And then if we talk about women, because that's obviously a big conversation too, trying to optimize hormones outside of hormone replacement therapy, like, again, if we were to stereotype and talk about generals, like what are usually some of the things that you, different from men, are talking to the women about that also affect their hormones that don't involve the medication?
So I would say, again, kind of reminding them that we have to look at the whole body, right? And look at, again, your insulin, your thyroid hormones, all of these other things. So I would say a stereotype for women coming in are, again, women I would say in their, let's say, 40s or 50s, kind of hitting that age where, you know, perimenopause is starting to go down, and they'll notice, you know, weight around the midsection, that they're not able to cardio their way out of. They're
not enough spin classes in the
they've probably been on a lot of yo-yo diets in their life. That's a big one. They are, they're noticing just, you know, maybe a little bit more aesthetic things like less skin elasticity. Their hair is falling out a little bit more than it used to.
Yeah, the hair loss.
Yeah, the hair loss. Their big things are obviously their sleep quality starts to go down, especially with declining progesterone. Maybe a little bit more anxiety. So these are some of the things I see with women. And again, but I would say a big one for women is, you know, weight gain is a big one that they're just not able to lose. And so again, getting a full picture of, okay, you might be, let's say, low in progesterone, and that's something we might want to replace. But that's probably not going to solve all your problems, you know, and we have to look at everything that might be contributing. So kind of similar to men, slightly different stereotype, we need to get a complete picture and, you know, do some testing, whether it's, blood, saliva, urine, look at their lifestyle. As we kind of talked about before, a lot of women are doing a lot of cardio, maybe going through like some yo-yo diets that are messing up their metabolism.
They tend to have a lot of cortisol issues, hey?
So when it comes to cortisol issues, it's way more common, I would say, for women than for men, especially cortisol issues that are affecting sleep is a big one.
We're all a bunch of worriers.
I think, 100%. So I think that the whole, you know, HPA axis piece of the puzzle is a lot, is a big focus for women. So as we talked about, like empower them to get into things like strength training, eating more protein.
The protein's a big one.
Protein's a big one, especially for women. I find that they're so under eating their protein.
Yeah, it's a very big issue I see with a lot of my patients is like, they think like 2 eggs is a high protein meal. Or something like that. You know,
totally.
Like, or like, you know, just the challenges that go on with like maybe eating like a vegan diet or something like that. It's just like you just need to pay a lot more attention to it.
Totally.
And I will say I've noticed that too in women. They're not good at protein.
100%. And so I think, I don't know what it is, but I think that, women are scared to lift weights. And then for whatever reason, they, when you actually look at their diets, like it's a lot of carbs. And like, oh, you know, like I'm having like a rice cake with this. And like they're like in their mind, they're eating a pretty, you know, calorie restricted diet, which isn't necessarily what they should be doing, but they're also just way under eating protein. And they're always in this state of being hungry and snacking. And, you know, that's what I find with a lot of women. And I say like, if you eat complete meals, prioritize protein, get in like some good healthy fiber, healthy fat, all these other things, like you're not gonna actually feel like you need to snack so much throughout the day. You might be actually eating more calories, but you're gonna have a better metabolism as well, you know, and you're gonna be doing your body more favors when it comes to helping to lower your cortisol, helping to put on muscle mass, all these other things, you know?
Totally, the weight gain could be declining sex hormones, or it could be increasing cortisol, and things like that.
Totally.
Probably a combo.
Yeah, definitely.
Of a lot of different things.
Yeah.
Okay, so, I mean, we won't go too much further into this just because there's not enough time. And I'm trying to keep it short, although it's very hard. So I kind of want to end with talking about, like, personally, what are some of your favorite, like, biohacking tools that would, like, fit under that umbrella that you're like, this is something I actually do myself that I find useful?
I would say sauna is a big one. I love to sauna. It's something that I probably do at least 2 to 3 times a week.
Nice.
It's, there's just so many amazing benefits, and like we could go down the rabbit hole, but love sauna. Strength training is a big one. Trying to do that at least a couple times a week. If not, I would say 3 to 4.
Nice.
And breath work is a really big one for me. I don't know if it's a biohack, but it's one of those things that really sets me up and calms down my nervous system and connects me to my body.
Yeah. So you feel like that's a big needle mover for your stress?
Yeah. And I feel like I take supplements. I take a lot of different supplements, but they change like based on my needs on a weekly basis. So I would say there's not like a specific one that I'm like, this is the biggest needle mover for me.
No, right?
You know? But I think that those are big
the habit-based things.
Yeah.
Like sweating it all out, getting the detox going.
Yeah. And then just like little, like I would say just as much as I can improve my sleep, like my whole life changes. Yeah. For sure.
Yeah, really focusing on that. Well, and you have the Aura Ring, right? So you can track a lot of it. Yeah, like again, like what is a biohacking tool? I'm not sure, but like my Aura Ring is probably my favorite. Yeah. Because it's like, it's just data. The other thing I really like about it, like sleep for sure, like I like love seeing what affects my sleep. Alcohol is a big one. What I've noticed in recent years is every time I go like camping or like deep into the woods where I'm like pretty far removed, not just like, oh, like a little cabin time, but like, you know, out of internet or like cell signal and things like that, I've never had better sleep scores. Yeah. And Chris notices it a lot too. Like he gets, like he'll sleep 9 hours here in the city and, you know, have like a 60 or, you know, like % score, like not a great score. And then he'll think he's having a bad sleep camping in the middle of nowhere because you're on a mat and your back hurts or whatever. Like it's not like optimized. And all of a sudden he'll get like a 90. Yeah. It's like seeing how much like nature and like removing myself from like cell signal. Oh, totally. I just makes a huge difference, but not always the most practical. I can't go just like live in the middle of nowhere, but like having something to track that and like really like getting good information over like what really helps. Cause like theoretically a lot of things help our sleep, but you will find that certain things affect it more than others depending on the individual. Yeah, I completely agree. I think that like, because I mean, I live on the 27th floor of a building in the middle of Vancouver, and there's like lights coming through everywhere. There's like a million Wi-Fi's around you, and you know, there's constant stimulation of you're just hearing honking,
like hearing an ambulance every hour. So I think that when I go to my family's cabin in the middle of Saskatchewan, and it's like it's just peaceful. You can hear the crickets. It's like it's in nature. I feel like my sleep gets so much better, and I have those like knockout sleeps that I don't really get in Vancouver. So I think that your environment has such a big role to play. So that's a cool one. Yeah, I really like that one. And then like just using your HRV scores to dictate what kind of exercise you do. Yeah, that's a good one. So like, because like I'm not like completely no cardio ever. Yeah. Even though I have dialed that back a lot to help my nervous system. But I do know that like if I'm going to go for something like a long run, a spin class, something more intense cardio, I will not do it anymore on the days I don't have good recovery, don't have good HRV scores. Yeah. Because it's just like I'm just gonna feel like crap. That's a good point. I think that, you know, when the Aura Ring will give me like a low recovery score, it's not like I'm like, okay, it's time to like lay on the couch and not do anything today. I need to let my body recover. It's like, okay, no, like I'm still going to move my body. I'm still going to exercise, but it's like, what type of exercise am I going to do? Exactly. Yeah. Like kind of like you said, like I'm not going to hit a boxing class when I have such low recovery because that's just going to throw fuel on the fire. But you know, if I'm at a point where good sleep scores, good recovery scores, and I'm feeling good energy, like I am going to push myself a little bit more and hit a boxing class. So I think being able to, just sort of play with the data of what you can do to best optimize your own body and your own physiology is cool. Yeah. Well, I think that's a pretty good place to end. Thanks so much for coming on. Thanks for having me. Yeah. You're a great first guest. It makes it really easy because I know you well. I know that you're awesome at what you do. And there's so much more that we could talk about. So you're going to have to come back. One. Yeah, exactly. You'll be my #1 guest. Thanks again. And if anyone wants to
find you, you know, maybe work with you as a, you know, as a patient or anything like that, can you just give a little bit of info?
Yeah.
Where are you practicing?
I practice in Vancouver on West Broadway. You can look me up on Instagram, Dr. Tessa Stark.
Yeah. Good place to find you.
Or drtessastark.com.
Nice.
Yeah.
Awesome.
Awesome.
Great. Thank you so much.
Thanks for having me.